And as I said, it does take about 6 to 8 weeks for it to move through the population. We still have time to blunt the impact of this transmission by getting people vaccinated. I cannot stress enough the importance of influenza immunization right now, this year in particular, as the best protection we have against infection and severe illness from influenza, and particularly for children who we are seeing being affected right now. Influenza vaccines are available for free for everyone over 6 months of age in British Columbia, and we have enhanced vaccines for seniors over age 65. Just to remind people, those most at risk of severe illness or these complications from influenza are children under the age of 5. And I will say that there are nasal spray vaccines for children 2 to 17 years of age if they have concerns about needles. Older children and adults with chronic conditions like lung disease or heart disease. Pregnant people at all stages in pregnancy. The vaccine protects both you and your child and gives protection to the baby for the first few months of life where there's no vaccine yet available. So very important if you're pregnant or you're delivering or you have during the influenza season that the vaccine makes a difference for both of you. And of course, seniors over the age of 65. Now is also the time to plan for the holidays. And we are going to make it, and we are making it even easier and more convenient for people to get their flu shots and their COVID vaccines too, if you're due for those. And I'll be turning it over to Dr. Ballem to talk a bit more about that in a minute. But I do want to talk a little bit about the upcoming holiday season. Now is the time to plan so that you can have a safe and joyful holiday together with friends and families and loved ones, something we have missed for this past 2 years. But we are not out of the woods completely yet. So we need to be extra sure we continue to protect ourselves, our families, and our communities as we go into this important holiday season. And that means, number one, get your vaccines and ensure children are protected too, both for influenza and for COVID. Staying home or away from others if you're sick, especially if you have a fever. Fever is a pretty good sign that you have something that is infectious to others, and that's an important sign that you need to stay home and rest and recover. And take extra care around infants because we know they are susceptible to more severe illness, and so we need to protect them when we're in respiratory season. Cleaning our hands regularly, practicing respiratory etiquette, which means covering your cough, using your sleeve or a tissue and then disposing of it. Wearing a mask. If you have very mild symptoms and you're not sure if you're incubating something, or if children are sick, for example, in your house and you go to work, those are times when wearing a mask as a prevention measure is important. And we should think about postponing visits to people who may be more at risk if you're not feeling 100%. We also encourage people to wear a mask if you want that extra protection, especially if you're in a crowded indoor setting with people you don't know. I think it's also really important for us to remember what we've been through in the last 2 years and make it okay in your holiday plans for people not to come or to be able to participate remotely or outside if they or someone in the family is not feeling well. Even if they're ones that are supposed to bring the turkey. Make it okay. We've found many, many ways to be able to safely be together, whether it's virtually or outdoors if we need to, and we need to remember those ways as we go into this holiday season. We need to remember to be patient and flexible this year as we transition to more normal celebrations like we used to have, because we still have COVID-19 and also influenza here now. I also want to talk a minute to faith leaders. And I am so appreciative of the way that faith leaders have supported communities across this province through these last few years. And I want to encourage you again to find ways to celebrate these most important days that are coming up, that people can participate safely, having the ability to broadcast, for example, or to participate remotely for those who feel sick, or for people who feel at risk and aren't comfortable yet in being in those settings with others. The many ways faith leaders have been supporting their congregations through these difficult years, those are things that we need to do again to get us through this year and to be able to celebrate together. As I said, typical influenza season lasts about 8 weeks, so it is not too late to make a difference now. We can blunt this curve, prevent the spread to family, to loved ones by vaccination now, before the holidays, so that we can have safe and joyful gatherings and activities together. And as I said, we're going to be making it much easier for parents to add this into their day during this busy time. And I'll now turn it over to Dr. Ballem to give you some details.